Hey guys, welcome to our channel, and today let's study status epilepticus. Now, status epilepticus is a medical emergency. It's characterized by recurrent or continuous attacks of tonic-clonic seizures. It could be without recovery of consciousness or a single episode lasting greater than 30 minutes. Practically, a seizure attack of greater than 5 minutes must always be managed as status epilepticus. Now, the causes could be abrupt withdrawal or non-compliance of an anti-epileptic drug by the patients, and this is mostly the cause of the status epilepticus. It could also be due to an underlying metabolic disorder such as diabetic ketoacidosis or metabolic acidosis. It could also be due to intracranial infections or lesions of the brain. Now, status epilepticus is a medical emergency and is managed by hospitalizing the patient, maintain airway and administer oxygen, establish an intravenous or an IV line, collect blood for estimation of electrolytes, glucose, calcium, urea, creatinine, liver transaminase, and for a complete blood picture. Administer intravenous 50% dextrose, and maintain fluid and electrolyte balance. For the seizures, give intravenous diazepam 10 mg or lorazepam 4 mg slowly over 2 minutes. Now, the dosage of diazepam and lorazepam is important because examiners love to ask these questions, so memorize them. If the seizures do not stop, you can repeat this after 15 minutes. If the seizures continue beyond 30 minutes, administer IV phenytoin at a rate not more than 50 mg per minute. Alternatively, you can use phosphenitoin. Monitor cardiac rhythm and blood pressure while giving phenytoin or phosphenitoin. Now, if the seizures are still uncontrolled, the next step would be to give phenobarbital. An additional dose of phenobarbital may be repeated if necessary, and check for respiratory depression and hypotension. If seizures still persist, they are finally managed by general anesthesia and a neuromuscular blockade, along with ventilatory support. Anesthetic agents used are midazolam, propofol, and pentobarbital. Once the status is controlled, long-term anti-epileptic medications are started. The underlying cause is identified and addressed immediately. This is a flowchart summarizing all the medications to be given to control seizures in a step-by-step fashion. So let's begin with step 1. Always give lorazepam 4 mg or diazepam 10 mg IV and slowly. Repeat this step after 15 minutes if the seizures still continue. Instead of lorazepam and diazepam, you can also use phenytoin or phosphenitoin. Now, if the seizures continue beyond 30 minutes, go ahead and administer phenobarbital. And if seizures still persist, the last result would be to proceed with general anesthesia with IV midazolam or propofol. The seriousness of status epilepticus could cause cardiorespiratory dysfunction. It could cause hyperthermia. It could cause rhabdomyolysis, which is the breakdown of muscles. And it could cause irreversible neurological damage because of the constant excitatory state of the body. Alright guys, we've gone through a quick overview of status epilepticus, and now I'm going to ask you a very common competitive examination question. Hopefully you will be able to attempt it. Which of the following is the current drug of choice for status epilepticus? Is it diazepam, also known as Valium? Is it phenytoin, known as Dilantin? Is it chlorpromazine? Is it carbamazepine or chlordiazepoxide? Now, if you wish, you can always pause the video, think about it, and try to attempt it. If not, we can go ahead with answering the question. Alright, for those of you who paused it, I hope you guys could answer it correctly. If not, we're here to solve this question. Whenever in doubt for selecting the correct answer for a multiple choice question, always play the game of elimination. So let's start with chlordiazepoxide. Now, this is a sedative and a hypnotic, so that's eliminated. Then we have carbamazepine, which is an anticonvulsant, but not the drug of choice. We have chlorpromazine, which is an antipsychotic. Then we have phenytoin and diazepam. Now both were mentioned in this video and are both given during status epilepticus, but we have to choose one. And if you remember, diazepam 10 milligrams was one of the first options in step 1, and therefore that is the drug of choice. Okay, we've come to the end of this video. Thanks for watching, and I hope you guys learned something. If you did, go ahead and subscribe to my channel, and don't forget to hit the bell icon so that you guys could be notified each time I upload a new video. Happy learning and all the best to you for your exams. Until next time, bye.